Hello everyone, welcome back to my channel. Today I have a very special guest. Her name is Dr. Raygoza, and she has agreed to come and help us answer a couple of very high yield questions. So thank you so much for your time, and welcome Dr. Raygoza.
Hello.
Thank you for your time. I have a series of questions for you, and I wanted to start with just like a getting to know you question. I know that you went to UAG, so just if you can let us know who you are.
I am Dr. Raygoza. I started UAG in 2015. I did have a leave of absence for 6 months because I had twins. So I had 6 months off. I came back and I graduated in 2019. Before UAG, I went to UC Riverside here in California, and I was actually told that I wasn't going to make it to medical school from an advisor, like a medical school advisor. And I just looked at her and I was like, you know what, I want to prove you wrong. So I did my best, MCATs, and yeah, my GPA wasn't like great as, US students in medical school, but I had heard about UAG actually at a medical school conference up in UC Davis years before that, and UAG was there. So UAG was always in the back of my mind. And once I did apply to DO schools, osteopathic schools, and I didn't get in. And I was just like, okay, let's try UAG. So I did, and I got in, and overall it was a good experience, but there is definitely room for improvement.
Thank you for answering that. Yeah, it's very interesting to hear how different people hear from UAG, because it's not very well known. I feel like the Caribbean route is more known, and the DO route, of course. You finished in 2019. Have you taken your steps by any chance?
I have. I actually just finished CK, and I just received my passing score last week.
Yay! Congratulations.
Thank you. Yes, it's hard. I'm not gonna lie. It's a hard journey. I think I understand that now. You guys are system-based, like your classes. So when I was in school, it wasn't that way. We were just class-based. So I had biochem, I had anatomy, physiology, neurology. It was separate, right? So each semester we had different classes. So for me, that way of learning was nothing compared to how we're supposed to be studying for step 1, step 2, CK, and all that. So basically, I learned all these stuff on my own. I did use osmosis. I used RX, USMLE RX, and then for CK, I used AMBOSS. So I felt that I had to do all these resources. I'm not sure how it's now. Maybe it's a little bit better since it's system-based, how the US is based. So, but what I did notice was that with UAG, they only focus on their material, okay, this is what you need to learn for our exams, but it's not really geared towards step 1. So what my advice would be, just get your first aid, just have that since the beginning, because honestly, if you know what's on that book, you'll be okay for step 1. And of course, other resources, there's a bunch of resources you could use, but having a program, AMBOSS is really good. I wish I knew about AMBOSS for step 1 in conjunction with UROAD. UROAD is always the number 1 to go to, but AMBOSS is really good too, because it's another Q bank, but it's programmed to where you're learning through the questions. And there's a bunch of x-rays, and it highlights things, because sometimes you're looking at x-ray and it tells you oh yeah, you're supposed to see blah, blah, blah. And I'm looking at it and I'm like, well, I don't see anything. but AMBOS, they actually highlights, and then you could actually see, okay, this is what they're saying, this is what I'm supposed to do, and they compare like normal to abnormal. So I felt that AMBOS was a really good tool, and I'm hoping to use that for step 3 as well.
Okay. So it's a question bank, but their answers, explanations are very well made.
Yes, and there's actually like there's a bunch of information within that, but I just used the QBank. But yes, it's a wonderful resource. If you guys could use it, I would really recommend that one.
Oh yes, there's honestly a lot of resources out there, so choosing which ones work for you, it's like once you find it, you just stick with it. So
yes, and it's a routine, and you really have to dedicate yourself like at least 8 hours a day while you're studying for these exams.
Yes, now that you mentioned like how many hours, I wanted to ask you time-wise, how long did you study for?
I feel for me it's just different because I am a mom. I'm a mom of twins. They took a lot of time, especially now with like since last year with COVID. I was at home with them, like we were staying home, so my study schedule it was crazy. So what I had to do actually during the summer that they weren't going to school anymore, I sent them over to my suegros. So I would stay all day just like studying from like 8 a.m. to 6 p.m. Just study all day. And that's the only way I was able to do it, because here they were just a distraction, even though they weren't in the room, like I could hear them and everything, but I wish I had more time. I feel like 8 to 10 hours a day is good, but it depends on what you are learning or how you study, because some people sit down but they're not actively studying. They're just like kind of like wandering off and stuff. But what I would do, I would actually time myself. Like the beginning of me starting studying, I would time myself. If I would take a break, I would like stop the clock and then, have lunch or snacks or whatever. And then I would restart the clock again. So I would do 8 hours, but those were 8 hours of studying. That didn't include any breaks, any lunch time or anything like that. So 8 to 10 hours a day, I would say is good, depending on how you are on the material. For me, since I graduated in 2019, so I didn't really start studying until August, September of 2019, like back for step 1, just because during school, during rotations, it was a lot, like doing rotations and being a mom and being a partner. So I feel that my journey is a little bit different than maybe most of you guys. But I would really encourage you guys to really have that exam before your third year, before rotation, because you do need to know all this material when you're actually with a doctor, because they do ask you questions and you don't want to just sound like, oh, I'm not sure, or oh, I don't know. So, and in many schools, actually all schools, Caribbean and US schools, you need your step 1 to start rotations. If you don't have step 1, then you can't rotate. So I did feel bad. I felt bad that you rotate with other med students and they know like all these things because they took step 1. And then you're just here kind of like, well, I'm not sure, or I don't know. So you don't want to look bad, you're making yourself look bad, you make the school look bad. So I would really encourage you guys to take it before third year or before second semester of third year. It just helps you rotation wise. And then during this 3-4 year, third year and fourth year, you need those letters of rec. So you want to show your doctor, hey, I know my stuff. Like, I'm ready to go to residency. Can you please give me a letter of rec? So it's all a combination of you need to get your things together so that you could be ready for residency.
Where did you rotate?
So I rotated in Arizona, in Phoenix, Arizona. I actually wanted to go to Las Vegas, but Las Vegas is really tight. Like, there's not many spots. But just keep your options open. Phoenix, I feel, is one of the best ones. I've had colleagues go to different ones, to Chicago, to Reno, to Las Vegas, and Tucson. But I feel that Phoenix has a lot to offer because there is different organizations that you could like join. Like there is 100 Angels, and that's volunteer work. And basically, you're being the doctor. You know, you see immigrants from detention centers that are being released, and you get to examine them. You get to, you know, just do checkups. And this is already volunteer work that you need for residency, because they do look at that. They look at, have you helped out the community? What have you been doing, you know, throughout your rotations? It's not about just studying and doing rotations. They always want, you know, a little bit more, like helping out and stuff. So I really like Phoenix. There's actually an AMSA chapter 2 in Phoenix. I'm not sure that there is one in the other locations because my friends actually started it in Phoenix. They're UAG alumni also.
Thank you for that. I forgot that you still have to do extracurriculars in rotations. For some reason, I thought it was just first year and second.
Yes, and I mean, nobody tells you these things, you know. I certainly didn't know. So I'm just glad to spread the word.
No, yes, thank you. I have another question on rotations, if you don't mind. Did you take exams throughout that time?
So that's another thing that we don't do. So they're called shelf exams. So you're supposed to take one after each rotation, and depending if you pass or fail, it's if you actually pass the rotation and you get to go to another rotation. So I had no clue of these because UAG didn't tell us we had to do them. But you do, like I said, you rotate with other students. I was rotating with Western students, which are the osteopathic med students, and they would take shelf exams after each rotation. And it's basically, it depends on the rotation. So if you're rotating pediatrics, it would just be pediatrics. And actually, UWorld has a, like it has the Q bank for step 2CK, and it actually has shelf review. So you could take like I guess it's a practice shelf. I'm not sure. I didn't really click on that. So, but yes, those are the shelf exams after every rotation. But as of what I know, UAG, we don't do that.
Oh, okay. So you just went from rotation to rotation without needing to pass a shelf exam.
Exactly.
But the shelf exams are important for us to do for step 2CK.
I guess you could do that. Shelf review on it has it on UWorld, it has it on AMBOS. So I guess you could just look over it and see if it does help during your studying for CK.
Oh, okay. Okay, thank you so much. So I recently saw that you are ECFMG certified.
Yes.
So congratulations on that.
Thank you.
I'm slowly learning about what that is. So if you can tell us, first of all, what is ECFMG? What do you know about it? So that we can know a little bit more.
Yes. So I was just like you. I didn't know what the heck that was. I didn't even know about steps, to be honest with you. I went to med school and I thought it was just going to be like undergrad. Okay, you do tests, you do exams, you finish med school, and bam, you're a doctor. But little did I know, we had to actually do these exams, the steps exams. So slowly I was like, okay, we need to do these exams. Like, how are we going to prepare for it? So then we started to look at programs and say, okay, what's going to be best for us? So I did a couple, and honestly, it depends the way you learn too. If you're more visual, if you're more of a just reading or listening. So there's a bunch of programs. For me, I think the best was Osmosis, RX, and AMBOSS. So from there, you just start studying and try to pass exams. It's very important to try and pass them on the first time, because in Arizona there was a chief doctor that I work with, and she was like blunt with me. She told me that for her program, they filter you out if you don't pass like your exam the first time, either step 1 or CK or CS. So I was like, wow, like they don't even look at your application because they just filter you out. So that's always something to keep in mind. I know they're not an easy exam, but if you're not ready, if you don't feel ready to take them, don't take it. It doesn't matter how long it takes you to be prepared, but the point is that you're prepared enough that you're gonna pass and that you're gonna get a decent score, because it's really competitive. We are always competing against the US med students. And I have noticed that they do prefer US students or Caribbean students. So this is where ECFMG comes in. So we are considered international because we went to school outside of the US. So even though we are in most part, many of us are US citizens, but we're still considered international. So that was my dilemma now, because I didn't really know. And when I was asking, I just told them, like, I am a US citizen though. So how does that work? Because when they tell you, oh, you're an international student, sometimes they automatically think that you're not a US citizen, that you need a visa or you need a residency or something. So from there, they're like, okay, so this is a process that you have to take to be certified to be able to work in the United States, even though you're an international student. So basically, that's where the steps come in. Everybody in the United States have to take these steps in order to work here. And so once you pass step 1, step 2, CK, before it was CS, since COVID happened, CS has been canceled. So now there's another test called OET, which is an English test. And once you pass all these 3, you're considered ECFMG certified. So since I took all my exams, now I am considered certified to be able to work here in the United States.
Oh, wow. Well, congratulations again.
Thank you.
It sounds like a long process. When do you recommend you begin? Do you need it before you take steps?
Yes. So you go online, it's ecfmg.org. You create an account, I guess you could say. But basically from this website, that's where you register to take your exams and stuff. And then you also register for when you're applying to residency, because you'll have like an ECFMG number, and that's your number that you're gonna have for everything for here in the States, for residency, for exams, for anything you need that number. So you could get it whenever you want, but it is important like that you have it. If you're preparing for step 1, you will need to get it, and then from there you're able to apply for the exams.
Oh, okay. Thank you for that. And then the ECFMG, I guess you would just need to tell them where you're going to school. And does UAG have to send them anything? So
you register online through ECFMG. You're going to put all your information, and then you give UAG that number because UAG needs it. So when you're applying for any exam, you do your application online, and then you have to let UAG know, oh, hey, I already turned in my application, and then they kind of guide you, saying like, okay, this is what you have to do and stuff, because UAG does have to send in your transcripts and everything for you to be able to do the whole certification at the end.
Perfect. Okay, thank you so much for that.
You're welcome.
So now I have additional questions. one of them would be how important do you believe UAG grades are for residency match?
Honestly, I don't even know because I know we need to pass and we have to have, I guess, good grades. But honestly, like in the United States, it's a pass or fail. You don't get like percentages or anything like that. So I'm guessing as long as you pass and you're good, like honestly, grades don't really matter. The only grades that matter are step one, CK, and if CS ever comes back, CS. I feel that should be your main focus because that's what's going to get you a job and a spot in residency, your step scores. Because I'm not sure how in detail they look at, your grades from school.
Right. Yeah. It's a little unclear. Just because right now the international program, they give us a letter of grades within the school portal, but then at the end there's like an additional toolbox system where we're scored out of 10. So it's a little confusing as to what they will send at the end to residency.
It's uncertain. I mean, I have friends that have matched and that they're already in their second year of residency, and honestly they were never asked about grades in school, like they just asked about step scores and volunteer work and what their plans were, and that was pretty much it. So I would just recommend study for steps and get those done as soon as you can.
Now that you mention like extracurriculars, what extracurriculars have you done so far, maybe during medical school too?
So before medical school, I was in this organization called Flying Samaritans here in UC Riverside. And basically we would go from Riverside to Tecate, Baja California, and we would just provide healthcare for the citizens there in Tecate. So I did that all through undergrad, and then even when I would come home during the summer from med school, I would go like once or twice because it was monthly. So I would go and I kept doing it. And my goal was to do it after med school too, but COVID hit and it got crazy, and even till now we haven't gone back. And then during medical school in Guadalajara, I did GMedic. That one is great too. Like, you're super hands-on, you learn so much. Doctora Suhey is a great teacher. She guides you, she helps you, and I think that was just a great experience for me. And she's known like everywhere. Like she went to Europe, she got her degrees and stuff. So she's just a great person, and I would really emphasize that you should do GMedic when you're out in Guadalajara. And after that, 100 Angels here in Phoenix. And that one's very nice too. You get to interact with kids, you interact with adult patients, So just anything that you could volunteer in, I think it would be great. I actually enrolled right now too for the Red Cross, disaster relief. I'm waiting on approval for them too. So just anything that you think is like a cause for you. Like if you want to do pediatrics, then try to lean more, with kids. If you want to do internal medicine, lean in with adults. But the programs want to really see you interact with whatever profession you want to go into, or like what specialty you want to go into.
Thank you so much for that. Yeah, I feel like it is difficult. I haven't personally gone to Mexico yet. So yeah, I do hear a lot of great things from GMedic, but I haven't had that opportunity yet. But thank you for highlighting that, because I'll definitely look into it if we ever go back. We don't know yet. How was the anatomy part? Did y'all have labs?
Yes, yeah. So we had anatomy class, and then we had anatomy lab, which we used the cadavers. We did use cadavers, and it just, they were not fresh cadavers, so they were kind of old, and then everybody used them, like, depending, because we were split up, because we were, like, my class, the first class I was in, we weren't that many, we were about, I want to say 60, so we got split up into 3 labs, and then, so it was about, like 10, 15, 20 of us in one lab, but then other classes would come, and they would use it too. So sometimes, you didn't really get to dissect that much because it was already dissected. So you didn't get to practice, the cutting and stuff like that. But I mean, it was a good learning experience because I had never seen a cadaver, and that was kind of like a different experience. I was like, oh my goodness, like there's a body in front of me. But we got to, look at the organs and take them out. Sometimes we were able to take them out. So that was good. I had, my professor was Dr. Valdivia. I'm not sure if he was still there for the other generations, I guess. But he was really good. He actually taught us well. And a lot of people didn't like him because he was kind of tough. But I feel that I learned a lot from him in those labs.
Oh, that's good. I'm glad that you had some sort of lab, I guess. I know that in the US, I don't know how it is in the Caribbean schools, but they do have, fresh cadavers, so that you can go in and be part of the entire process of dissecting and stuff like that.
Yes, yeah, we didn't have that.
And now with online, it's been very interesting. So many YouTube videos on just like the rotations of things,
Yes, I know. Yes, but there is a lot of resources online, so that's good.
Yes, definitely. Okay, I have another question. I don't know if you have encountered any scholarships or programs that are open to U.S. international medical graduates.
I have not, but to be honest, I never really looked into it, so I wouldn't really know. There's not a lot of opportunities for us as international students, but the U.S. do need those international students because there's a lot of non-Spanish speaking doctors in the U.S. and there's a big population of Spanish speaking citizens population. So even though we're not being picked for much of programs, they do need us. And that's another thing to keep in mind when you're trying to look at programs and applying to residency. You have to look at what percentage do they have of IMGs, like international students, because the process of applying to residency is not cheap. It gets pricey. And you don't want to just be applying to programs that you definitely won't have a chance, because there are programs that there's just like 0% IMGs. And that's a lot of programs, honestly. So you have to apply smart, apply to programs that have, the same step scores like you do, that they accept the people with your same step scores, and also if they actually have IMGs present there too. Because especially here in California, it was really hard for IMGs to get residency, but last year there was an increase of IMGs. I want to say 4 or 5 of my colleagues matched here in California.
Aww.
Mm-hmm. So that's a big number compared to other years.
Oh, that's really great. I want to match in California. That'd be wonderful.
Yes, I know. That's what a lot of us hope for. But slowly, we're getting there. And honestly, you just have to make connections. You need to talk to people. Right now, like I said, I think there's 4 or 5 UAG alumni in the in California in internal medicine and family medicine. Mm-hmm.
Perfect. That's great, because that, it's possible. You just have to keep at it.
Yes,
Right?
yes, it is possible. It's just that you gotta work a little bit harder than any other U.S. student or even Caribbean schools, because even though Caribbean is considered international, they have a little bit more of a preference. Their curriculum is really, really close to the U.S. curriculum. So sometimes schools prefer a Caribbean school than like any other international school, because they know their curriculum. They know that these students have step one before entering third, fourth year. And that's why there's a preference for that too.
I didn't know that.
Yes, I didn't know that either until recently. I have actually 3 friends that went to the Caribbean. So now that's what I know, and I searched it up a little bit more too, and yeah, like they're basically learning exactly the same as the US, but just outside of the US.
Right. Yeah, I'm very interested to see if it's how UAG has it now, because we do have system-based, and I personally am using Boards and Beyond. A lot of the books that are referenced for the Boards and Beyond, which is 4-step essentially, are the books that we're using at UAG. So that's why I'm kind of comfortable with knowing that we're kind of like on the same route as the US students.
Yes, so when I was in school, we were not system-based. So then it switched to system-based. So I was like, okay, that's a good step, for UAG, because they need to match what the US is doing essentially, and prepare you guys for step, because that's ultimately the goal, for you to pass step 1 before your third year, before rotations, because that's how everybody else does it.
Right. I have one more question about your rotations. You mentioned letters of recommendation. So I don't know if you advise for us to ask for letters of recommendation within that time, or if should it be after, when you're applying for school?
So I always knew what I wanted to go into. I wanted to go into pediatrics. So when I was rotating and I had my pediatric rotation, as you were asking me right now, I didn't know when to ask for it, but I always asked for my letter at the end of the rotation when I was at, it was my last day of rotation, and I would tell the doctor, like, hey, whenever I do apply, because I didn't know when I was going to apply, because I didn't have my steps at that moment, I told him, like, I would really like if I could get a letter of rec from you, because I want to go into pediatrics. And most of the doctors are super nice. They're not going to tell you no. So I just asked, and he told me that he would do it, he would write it. So afterwards, when I was ready to apply, I emailed the doctor again, and I just reminded him, like, hi, like, this is Dr.Raygoza. We work together this and this dates and stuff, and then either they remember you or they don't. So that's another thing too, like, yes, you could ask them for the letter once you're done with rotation, but some doctors have a lot of students, so you kind of have to be memorable to them, since the beginning. Like, you want to do internal medicine. Once you're in the internal medicine rotation, you kind of have to get to know the doctor, get him to know you too, like, have a connection with him, so that when you do end up asking for that letter, and let's say it's a year after when he actually writes it, he remembers about you. I've also heard that some doctors could write it for you then and there, just so that they have a fresh, perspective of you. But I do know that the letter has to be recent when you submit it. So I don't know, maybe not put a date until you're going to use it. But it just depends how the doctor would write write it for you or prefer to write it for you.
So do you have your letters saved in like a program?
So that's another thing. So there's a website where we apply for residency and stuff, and everything is saved in there. So you waive the option of seeing your letter. So, and that's what's recommended, that you don't see your letter. So I don't know what my doctors wrote about me. It's just saved onto the website, and then it's distributed to the programs that you're applying to. So then, and then some programs actually want you to have a letter of recommendation from program directors or for the department chair. So like in the case for pediatrics, they wanted me to have a chair doctor write it for me. But luckily, the pediatrician I work with, he was the chair of pediatrics. So it worked perfect for me.
Oh, wow.
So you have to research your program too. Whatever program you're wanting to apply, you have to look at, okay, what are their requirements? Because some of them require like three letters of, your specialty, or one of this or one of that. So you have to do your homework. Like it does take time to research all these programs to know what exactly they want to.
Okay, and then this information, you found it on the ERAS website or AAM?
I actually looked at the program requirements and stuff on Freida. It's called Freida. And there's another one, it's called matcharesident.com. And that one, I feel it's a little bit better because you input your info, like your step scores, if you're an international student and stuff. And then it kind of like compares you to other residents that are in that program. Like it tells you that IMG friendliness, or like, are you compatible with this or that? It is, you have to pay for that one. Freida is free, but Match a Resident, you do have to pay.
Is it like a one-time thing, or is it monthly?
Yes, it's a one-time thing. So basically, I paid $100 for this match season to be able to compare myself to this one. And then sometimes it tells you like, oh, this program wants a letter from a program director or a chair, like a chair doctor and stuff.
Oh, okay. So right now you're going to begin your residency application stuff?
So residency application starts in September usually, but for this year it started late. It started into October. So October is when you could start submitting all your applications, and from October to roughly December, because every program has different deadlines too. So you wanna, but the sooner you get your applications in, the sooner they get to see, and the sooner you get an interview. So it's very recommended that once it opens up, like for interview applications, you submit it like that day or a day before or something, so that everything's in. So I applied in October. I didn't have my CK yet. That's the only one I was waiting on. So as of now, I didn't have any interviews, and I think it's because I didn't have that CK. Because there's another thing too. Some programs say you don't have to be ECFMG certified to apply. So that's what I did. I applied to those programs that said that I didn't need it yet. Basically, they said like, as long as you're ECF, it's just these things you really don't know until you actually go through it.
Yes, unfortunately.
Mm-hmm.
It's expensive.
Yes, it is very expensive. So I have friends that started med school 2 years after me in UAG, and I've been going through all these things, and I'm like, you girls need to save up money, like it's easy to be in another country in Mexico and like, you know, things are cheap and you want to explore and everything. But at the end of the day, you went there to study. You know, you went there to get your foot in to be able to start residency. And some people sometimes lose sight of that, and it affects them. It affects them because they're not taking their exams when they should, or they don't end up taking exams. So like, just don't lose sight of that, you know, and save money because so far with Step and applications, I spent around almost $6,000.
Oh, wow.
Yes, it's pretty pricey, and nobody tells you this.
Yes. Oh, okay. Thank you for that number, because I do know that it's expensive, but I just never know how much. So thank you for that.
Yes, exams are expensive.
Yes, I recently found out that Step 1 is like $965.
Mm-hmm.
That's a
Step
lot.
1, CK is $965, CS is $1,600. But right now, well, it's canceled, so we had to do the OET exam, which that one was like 400 and something. But then your application for ECFMG certification is 900.
Oh.
Mm-hmm.
Okay. And the OAT is basically like an English test?
Yes, it's an English test. It's medical because it's medical based, but what you're getting tested is on reading, writing, listening, and speaking.
Oh, speaking as well?
Mm-hmm. Yes, they would grade you because, so how I was saying, when they hear international student, they assume you don't know English, that you're coming from another country. So this exam is basically measuring your proficiency in English. Like, can you speak to your patient in the United States in English? Can you write your notes? You know, do you understand the language? That's basically what it is.
Oh, okay.
Mm-hmm.
Thank you for that. I didn't know that existed.
I failed one part. I failed writing, which I was like, how did I fail? You know, like, I am a U.S. citizen. I did my school here, you know. But it's just, it was so dumb. Like, I missed a header, and that's why I didn't pass. I had to take the exam again. It was, yeah.
Oh no. Okay. You recommend prepping, or at least seeing like example tests? Are there example tests?
There is sample tests on the website. I mean, it was kind of my fault too. I took Step 1 on Wednesday, and then I took this exam on Friday. So I didn't really prep for the English test because I was very confident. I thought I was gonna pass because, hey, like, I know English, you know, like, so I kind of went in it and then just said, okay, I did review. There are sample tests, and I was like, okay, it's not that bad. But honestly, what gets you is the timing, because they time you. You have like, I think it's 45 minutes to do all these questions and stuff. So you're just not. You haven't been prepared for writing, for reading, for listening. You know, you're based on Step material that once you go into this, you're like, wait, what is this? You know, like, it's English, but it's a little bit different.
Right. No, thank you for that, because I was also thinking right now, maybe I should just take it, get it out of the way, like, you know, without studying, because it sounds easy, but
yeah, no, it's not that easy.
Yeah. Okay. Thank you for that. How many programs do you recommend me apply?
So IMGs are recommended to apply to 100 programs, because there's not a lot of programs that actually have IMGs, because in the US med students, they're just recommended to do 20, and that's why it's not that expensive for them. And even right now that I was trying to do for peds, there's a peds match 21 hashtag on Twitter, and they were telling future applicants to do less than 20. And then there was an IMG student or or applicant, they're like, oh, well, we heard that it was 100. And I kid you not, all the US students were like, what? Like, that's a lot of money, because each application is like $20. After a certain, after 20, I think after 15 or 20 application, like each application is going to be $20. So US students are just encouraged to do 20 because they're already US students. Like they have the favoritism, I guess you could say, that they're going to match. And IMGs, we don't have that opportunity as them. So they tell us, like, if you have the money, just apply as many as you can. I have a friend, I think she did like 120, 130 programs. It's expensive.
Okay, definitely noted, because I recently heard that, yeah, we do have to do more, but hearing numbers helps me like understand more, you know?
Yes. Yeah, so about 100. That's the goal.
Okay.
That's why it gets expensive.
Okay. Thank you so much for that.
You're welcome.
Any last remarks for UAG students in general about just like being in medical school, going through the process?
You are already in the door. You know, you're considered a medical student. You're considered a possible resident applicant. So now you just need to work on those steps. And that's ultimately your goal. Like nothing else matters. Like you just need to pass those exams, get a competitive score so that you could be able to match for the match. Yeah.
Perfect. Thank you so much. And I do appreciate your time to let us know what you've learned throughout your journey, and hopefully making it easier for us who are in the process and for who want to apply to UAG as well.
Yes, I hope this helps, and I wish I had some guidance. You know, I just went in, I didn't know anybody, and I'm learning. I'm learning on the process because I don't know everything. Honestly, just you're basically on your own when it comes to step prepping. So ask around, you know, ask if you have friends or if you know people in the upper classes, like, oh, what did you use for this, like to study and stuff. Because there is a lot of programs out there. It's just you have to really figure out what is best for you. And just, I know it's a time crunch because you want to get it done, you know, but you also have to be true to yourself and know, am I really gonna take this? Am I ready for this? Because you don't want to take it just because you're on a time crunch and then not pass. So only you know how prepared you are, you know, and do the MBMEs, do the UROAD assessments. And for me, those MBMEs and UROAD assessments were really accurate with my scores. So if you're not there, if you're not scoring the score you wanna get, then I would advise just keep studying, you know. And when you're studying and you already have a passing score for an MBME or UROAD assessment, focus on your weaknesses, because ultimately that's what you need to really work on, because the other things, you basically got it down. So work on your weaknesses and that will improve your score.
Perfect. Thank you so much.
You're welcome.
So thank you again for your time, and best of luck, honestly, for your own journey. I know that you're in the process of like getting into a residency, and I honestly do like cheer for you because you're like UAG, you know, like you have to make it, and you're from California, yes. You know.
And there is a lot of UAG students that or alumni that matched last year. So hopefully this year it's a good turnaround again.
Yes, I have high hopes. I feel like we will continue increasing those numbers.
Yes, and there's a new program in Phoenix actually with internal medicine, and there's 3 UAG alumni there. Honestly, I loved all the doctors I worked with in Phoenix, and there's a lot of opportunity I feel like in Phoenix. Because the other cities, I didn't really hear that there was like volunteer opportunities, and then even some rotations were like online too.
Oh, okay.
Like they were not really like in person, and this was before COVID. So.
Oh, okay. That's good to know. I think I should look into the programs as well. Now that you mentioned that.
Yes, and if you see anybody that's there, ask them like, hey, can I ask you some questions about, Las Vegas or Arizona and stuff.
In the Phoenix program that you mentioned, is it just, do you know the name?
It's Abrazo. It's under Abrazo.
Okay.
Mm-hmm. I heard Tucson was okay too, the one in Tucson.
Okay.
Yeah, because I think in Phoenix there's two. It's Abrazo and then another one, because it's considered west and east. Mm-hmm.
Right.
But sometimes they just get mixed, so you end up you travel.
That's fine.
Yeah.
As long as we get it.
Yes.